Hi everyone, welcome back to our COVID-19 stats report. My name is Sara, epidemiologist at the Jefferson County Health Department. Tonight we're going to be talking about the data from CDC Week 9, which covers February 28th to Saturday, March 6th. We had an overall weekly case count of 155 confirmed and probable cases. Our cumulative total dating back to March of last year has now reached 21,806 confirmed and probable cases. For the first time since the very beginning of the pandemic, we are reporting 0 cases in our long-term care facilities. This is definitely something to be celebrating because, as we know, those congregate living facilities are the perfect place for the virus to rapidly spread. We also know that many of these residents have an increased risk for developing more severe cases and complications from COVID. So it's exciting to see that that entire population is currently COVID-free. We are continuing to see our cases decline, and we had a lot of really great milestones in our data this past week. In figure 1, you'll see the visual of confirmed and probable cases as they're moving from week to week. Our weekly case count of 155 cases is the lowest we've seen since June of last year. These decreasing numbers tell us a few things. The masks are working, the physical distancing is working, and the vaccines are working. But we need to remember that now is definitely not the time to let up on any of our prevention efforts, or we do run the risk of experiencing another surge. According to the state, about 10.7% of Jefferson County residents have received their first dose of the COVID vaccine, and about 5.4% of residents have been fully vaccinated. The only way that we're going to achieve herd immunity is through mass vaccination. Because that vaccine rollout has been a little slower than we anticipated, we definitely need to make sure that we continue to mask up, stay distanced, and continue to avoid those large gatherings so we can keep these positive trends in the data going. We reported 222 deaths in the community. Our cumulative fatality rate in Jefferson County is now 1.02%, which has increased a little since our last report. Both Missouri's rate and the overall fatality rate in the US have increased as well. As we know, the deaths from COVID-19 lag behind those hospitalizations and the cases. So when we report numerous deaths each week, it's the result of those bigger case counts that we were having a few months ago. We will eventually start to see the number of deaths decrease just as the hospitalizations and the cases have. Table 3 shows our number of positive PCR tests, negative PCR tests, and that weekly percent positive rate. During week 9, we had 80 confirmed PCR positive tests, making that percent positive rate 4.6%. It's now been a month that our percent positive has been lower than 10%, which is incredibly encouraging. We haven't had a percent positive this low since June of last year. Please remember that this does not include our positive antigen tests. According to the CDC, positive antigen tests are classified as probables. Let's take a look at our color chart to check on some of those important metrics that help determine what the overall color status of the community is. The 7-day rolling average of cases per day per 100,000 for week 9 was 9.84. So we have finally made it into that yellow status, which is really exciting. It's been around 9 months since our numbers have been low enough to classify us as yellow. There are 2 other main White House metrics that help gauge how the spread in our community is looking, and those are the new cases per 100,000 per week and the percent positivity. Our new cases per 100,000 per week remains in orange at 68.89, and that percent positivity is classified as light green for week 9. We can definitely all be proud of the work we're doing to keep the spread low, but as I said earlier, we really can't let our guard down just yet. Yellow status does not mean that COVID is gone. It just means that we're doing a really good job of controlling the spread in our community so that there's less opportunities for the virus to replicate. And as we need to continue these safety measures until we see really low numbers for a sustained period of time before we're really in the clear. That wraps up our stats report this evening. Thank you to everybody for listening in and helping us in the fight against COVID-19. As always, we truly appreciate your cooperation and your support. Please stay safe and stay healthy, and be sure to reach out or check out our COVID-19 dashboard for more detailed statistics. Have a great evening and enjoy the rest of your week.